The Joey's Friends program was started and created by myself and my colleague Lisa Crilly. Each of us have a child with a developmental disability. My daughter has a very, very rare genetic syndrome called Pallister-Killian syndrome, and Lisa's son has Down syndrome.
Joey came to us at the age of 6 months old, and if anyone has ever fostered a child, you're literally handed a baby and trying to fill in the gaps. Obvious diagnosis of Down syndrome, was not aware of the medical complications that came in addition to. One of them being celiac disease, requiring a lot of blood work, one of them being kidney disease, requiring a lot of blood work. Fast forward, Joey is about 6 or 7 years old, and he started developing a fear of having blood work. When I say a fear, a paralyzing fear. Joey took a bed in Valley's pediatric unit for over 8 hours to have one blood draw. The stick took 10 seconds. So we started saying, this can't be.
We decided to reach out to various departments throughout the hospital where we saw our own children struggling and our patients struggling, and kind of made some cheat sheets in terms of what would help, what would make people feel more comfortable, what would make families feel more supported. So we made it our business to try to spread the word, and that's how Joey's Friends was born.
How old are you?
19. I should be 20 next year.
Lots of times it can be presented to other staff to say, guys, we're so busy, we don't have time for this training. Like, we don't have time. Like, we just have to get this x-ray done. And what we try to say is, it would behoove us to spend this extra 5 minutes to look at the things that makes him tick, to prepare the room in less of a bright setting, to lower our voices, to turn off loudspeakers, to do things like that. And this could cut everybody's work time down. And most importantly, be less traumatic for our kids.
Some of the tips and tricks that we've come up with: not waiting in the waiting room for extended periods of time. There's really no reason for that. It agitates the patient. We can call the parent and say, hey, why don't you wait in the car, circle around, give us another 15 minutes. We'll call you when we're ready to come right up and the room is ready.
Our children recognize fear. They respond to fear, very often with fear. They respond to compassion with sincerity. But Allison had the idea, why don't we get the blood drawn here at the Kirker Center? He's familiar with the Kirker Center. This might be a good idea. He is pre-registered for the blood, so he doesn't have to wait in the waiting room. What if you bring in the prescription the day before, and now you can email it or whatever the procedure is, and the tech has it, so she has the vials ready. I'll have my special friend drive Joey, who's going to drive Joey here today, have him come off the elevator at 2:30. He's going to open the doors, and before he goes, no, here's the iPad, and starts talking about Seton Hall. Let's try it. Let's see what happens. Joey eats, sleeps, and breathes for the Seton Hall Pirates. My son went to Seton Hall, my daughter went to Seton Hall. So Allison said to me, what's his favorite player? Miles Powell. Okay. She says, what is the most thing, when do you lose him with the blood draw? I said, it's the tourniquet. We can't get the tourniquet on him. Gets the blue tourniquet, writes Miles Powell number 13 on it. Sat down, okay, great. No, not the tourniquet. Oh my gosh, what does Valley Hospital have? Valley Hospital has a Miles Powell tourniquet. I said, let's go see. I don't think this one hurts. God is my witness, 10-minute visit. We got the blood.
We tell families all the time, we can't guarantee you that this is going to go beautifully when we come to do your, 8-year-old blood work. But what we can tell you is that we are really listening and we're really trying our best. And we ask you what TV show your child likes, and we will have that ready to go on our iPad so that when they walk in the door, we have Mickey Mouse set up so that we can distract him. And even if it doesn't go well, the parent is grateful that you've thought about it and you've planned, and it usually helps.
How to make it easier to
Mario-themed doctor's office.
There you go. There you go. Themed
All Mario, all over the place.
I don't want families to feel unsupported. I don't want families to feel that they are blazing a trail that no one else did. That's how I felt. That was the worst part. And so when I look at Jess now and I look back at my almost 23-year journey with her, she's given life to a program that will benefit so many other people. So I like to think that my hardships and my difficult times has a purpose.
To know that I had the support and the connection and the understanding of a hospital that really cared enough to have people who responded like they did to my Joey, I'm better. And if I'm better, Joey's better.
The Valley Volunteer Department, along with the Joey's Friends, ran a teddy bear clinic. And that was a really great one-day event where a child brought their teddy bear or their favorite doll to go through the procedures. Anytime we would welcome tours and appointments to prepare.
Keep your eyes and ears open on what makes these kids light up. If we can look at their positives and build on their positives, there's a lot of them. Sometimes you just have to dig a little bit when we can provide some amazing care.
There are a lot of group homes throughout our towns here in Bergen County, a lot of day programs, and the more comfortable we become with seeing individuals with developmental disabilities, the better for everybody. I am very, very proud to say, as of a month ago, she is now a volunteer here at the Valley Health System in the hospital, so you might even see her walking around delivering mail with her job coach.
What day do you usually deliver mail?
Tuesdays. I'm hoping to switch to Mondays, but I don't know.
It's Monday.
My job, not theirs.
Does Vicky know?
Yes.
We're creating a culture to increase our awareness. And you become, just like anything else, you become more keen for the next person and the next person. But once you've done it, it feels real good.
Such a unique position to be able to tell our families that we get it.